Hi, my name is Taylor Harrison, and my mini lecture will be on cystic fibrosis. Cystic fibrosis is a recessive genetic disorder, meaning that both mother and the father have to pass the recessive gene to the offspring. The disease affects the lungs and digestive system. It causes the body to produce a thick mucus in the lungs, causing breathing issues, and increased mucus in the pancreas, which causes issues with digestive enzymes. When these enzymes are blocked, this leads to poor growth in the cystic fibrosis patients. Bacterial infections seem to thrive in that thick mucus in the lungs, placing these patients at an increased risk for infections, which leads to further damage to the lungs. Common symptoms would be salty skin, coughing, frequent lung infections, and poor growth. I wanted to provide a little bit of background on cystic fibrosis. It was first discovered by a pathologist in 1939 who discovered the disease through a child who had died from malnutrition. The excess mucus was then discovered. It wasn't until 1963 that the first diagnosis criteria was completed, which included the sweat test and specific diagnostic symptoms. And finally in 1989, the actual gene that is mutated was discovered. Over the many years of research and further treatments, the life expectancy has increased, is now at 37 years of age. In 1986, only 29% of cystic fibrosis patients would live to be over 18, and now in 2013, almost 50% of cystic fibrosis patients will live to be 18 and over. So that's a huge improvement, and that's according to the Cystic Fibrosis Foundation. There are diagnostic tests for cystic fibrosis. It is gold standard that women be offered prenatal testing to determine if they are a carrier. If they are a carrier, it's then recommended that the father of baby be tested as well to determine if the offspring would be at risk for developing the disease. Families who the mom and dad are both positive for the carrier generally recommended to seek genetic counselors. However, since some women are not screened in pregnancy, some infants can go years without being diagnosed. Most children are diagnosed, however, by 2 years of age. There is a 3-step diagnostic process, first being the sweat test, which basically the child is, they collect a sweat sample and test that for the chloride and the salt content in the sweat. And also, of course, now we can do the genetic testing now that we know the specific gene that's mutated, and then also based off of clinical evaluations and symptoms. The good news is that there are some common treatments, however, there is no cure, so treatments are focused on decreasing the symptoms and improving quality of life. 3 main medications that cystic fibrosis patients will be on. The first one is called Pulmazine, which is a mucolytic, so it helps to break up existing mucus. However, it should be used with caution in diabetic patients as it can affect fast-acting insulin, so therefore glucose should be monitored closely. Another drug is called Kalydeco. It is a potentiator, meaning that it enhances the activity of the cystic fibrosis gene that is mutated. This helps keep the salt and water channels open, which decreases the amount of mucus produced. The third medication that is commonly used is azithromycin. This is a macrolide antibiotic, just meaning that it helps block bacterial growth. It can cause some electrical changes in the heart, so it should be used with caution with patients who already have heart problems or irregular heart rhythms. Most medications, however, are generally studied and approved safe in patients over 6 years of age. So some younger patients, some alternative therapies may be used as well. You will also commonly see some chest physical therapy or percussion. Sometimes this is used to help loosen the mucus. It can be used by high-frequency airways. It can be used by postural drainage to help patients get the mucus expelled. Since this is a genetic disorder, environmental and lifestyle preferences are not significant in your risk of developing the disorder. However, they are significant in improving and in managing the disease and attempting to optimize the patient's quality of life. Examples: proper hygiene should be used, well-balanced diet, regular exercise, avoid tobacco smoke and allergy triggers. All of those things can help a patient improve their quality of life by decreasing the risk for infection and decreasing their exacerbations of the disease. Patients also with proper therapy manage comorbidities can live productive lives. Females generally are able to reduce, however, some males are infertile because of the disease. The references that I've used in this disease process presentation are posted to the Blackboard for further questions. Thank you.